In this video, we're going to look at bacterial vaginosis, which is a common treatable vaginal condition that can increase your chances of getting sexually transmitted diseases. Bacterial vaginosis is defined as an overgrowth of primarily anaerobic organisms in the vagina. The vaginal tract is home to mostly good bacteria that are beneficial, and a few bacteria that are harmful. Sometimes, an imbalance between these two microorganisms occurs. When the number of harmful bacteria overwhelms the good bacteria, bacterial vaginosis occurs. It is the most common cause of vaginal discharge in young women of reproductive age, with a prevalence of 5 to 35%. The predisposing factors for bacterial vaginosis include decrease in lactobacilli levels in the vagina. This could be caused by douching, change of sexual partner, and episodes of candida. Increase in vaginal pH that could result from semen and after menstruation when estradiol levels increase. Smoking that is responsible for suppressing the immune system might facilitate infections. Intrauterine contraceptive device. Having a bath with antiseptic liquids. Using perfumed bubble baths, vaginal deodorants, and some scented soaps might also put you at risk of getting bacterial vaginosis. Bacterial vaginosis is caused by an imbalance of naturally occurring bacterial flora, which are the bacteria that normally live in a woman's vagina. One such bacteria that is normally found in the vagina is called lactobacilli. Because these bacteria produce lactic acid, the vagina becomes slightly acidic. This inhibits the growth of other bacteria. Lower lactobacilli levels in the vagina causes the vaginal pH to rise, making it to become less acidic. This less acidic environment provides favorable conditions for other harmful bacteria to grow and thrive. The most implicated bacteria include Gardnerella vaginale, which is a coccobacillus and a surface pathogen. Anaerobic bacteria like Bacteroides, Mobiluncus, Prevotella, and Mycoplasma hominis. You might be wondering, what causes fishy vaginal odor? The metabolism of this bacteria implicated in bacterial vaginosis produces volatile amines and organic acids other than lactic acids, leading to an increase in pH and smell of the vagina. Bacteroides and Mobiluncus produce succinate, a keto acid which raises vaginal pH. Mobiluncus produce trimethylamine, giving the smell of rotting fish. The absence of lactic acid and the production of succinate reduce the chemotactic response of polymorphonuclear leukocytes and their ability to kill bacteria. The signs and symptoms of bacterial vaginosis include vaginal discharge that may be thin, homogeneous, whitish-gray, frothy, and offensive fishy smell. Less commonly, there could be itching around the outside of the vagina, Dyspareunia or pain during sex, and a burning sensation during urination. The diagnosis of bacterial vaginosis can be made from a description of symptoms and a physical examination. Things to look out for are an unpleasant smell and a thin, white or gray discharge. Amsel's criteria is used to make diagnosis. 3 out of 4 is required to make a diagnosis of bacterial vaginosis. Thin white homogeneous discharge. Clue cells. These are epithelial cells with attached bacteria on microscopy. pH of vaginal fluid greater than 4.5. And fishy odor on alkalinization with 10% potassium hydroxide. This is also known as whiff or amine test. Bacterial vaginosis often clears up without treatment. The goal of treatment is to relieve vaginal symptoms, signs of infection, and to reduce the risk for infectious complications. The recommended regimen is oral metronidazole 500 mg twice a day for 7 days, or topical 2% clindamycin cream intravaginally at bedtime for 7 days. An alternative treatment is tinidazole 2 grams orally once a day for 2 days. There is 10-fold increased risk of pelvic inflammatory disease in females with bacterial vaginosis. The presence of bacterial vaginosis increases the risk of HIV infection acquisition in women. Tubal factor infertility, caused by damage to the fallopian tubes, which connect the ovaries to the uterus. Loss of pregnancy. Risk of STIs such as herpes simplex virus, chlamydia, gonorrhea, and human papillomavirus. That will be all for this video. Thank you for watching. If you find this video helpful, please like the video, share it, and subscribe to our channel.